In this lesson, we'll take a look at mental disorders. We're going to focus on schizophrenia, depression, and then some of the panic disorders. So, mental disorders in general are basically dysfunctions in the areas of behavior or personality. Now, they can be the result of biochemical changes, right, chemical imbalances, but they can even be caused by structural abnormalities. Many times when people have, let's just say, a tumor growing in the brain, right, brain cancer, one of the first signs and symptoms may actually be personality changes, right, that maybe even show up before the things that we saw in our previous lessons, increased intracranial pressure and that type of thing. You may see that just from a structural abnormality. There could be a genetic component, and some of the more severe psychotic illnesses include schizophrenia, delusional disorders, and even some mood disorders. But we're going to just focus on schizophrenia as far as psychotic. So let's start with that first. Schizophrenia is really a variety of different syndromes, and each individual is going to be different. But they have noticed some common things in different people, right? Things that are just common to schizophrenia. So let's look at some of those. This can include reduced gray matter in the temporal lobes of the brain, enlarged third ventricle, and enlarged lateral ventricles in the cerebrum. There's a part of the brain known as the hippocampus. They show abnormal cells. They may have an excess in dopamine secretions and even diminished blood flow to the frontal lobes of the brain. We don't know the etiology, but some of the theories include that there's a genetic predisposition, or it could even have been brain damage as a fetus. Right? So those are just some theories on that. So let's take a look at some of the manifestations, by signs and symptoms. They group them as positive and negative as far as their behavior. Positive would be delusions, bizarre behavior that they exhibit, where negative would be things like flat emotions, decreased speech. But some of the generalized symptoms that we see include disorganized thought process, impaired communication with inadequate language skills, delusions, false beliefs, and even false ideas. So, the main way that schizophrenia is treated is going to be by antipsychotic drugs, and then that's going to be supported by psychotherapy and psychosocial rehab. But just real quick on this, some of the antipsychotic drugs will have as side effects a lot of muscular types of signs and symptoms, and the reason is it stimulates or the drugs stimulate the extrapyramidal tracts. If you remember, the extrapyramidal tracts are the tracts that help to make our movements smooth and coordinated. So you'll see when they take these drugs, that smooth coordinated movement goes away, and they start to have involuntary muscle spasms in the face, the neck, the arms, or the legs. You'll see them kind of doing like chewing motions. They'll be having grimacing in the face, repetitive jerkiness, right, writhing movements. All of these things show up as a result of the antipsychotic drugs. One of them that you may run across is called Haldol. You don't have to put this in your notes. I just want to throw this out there. Haldol, when you see a patient on this, a lot of times they take on the appearance of having Parkinson's disease. So they actually, on psych wards, they'll actually call, when patients walk, they'll call it the Haldol shuffle. They actually, have that shuffling gait, similar to what you see with Parkinson's. Once you take them off the Haldol, those symptoms go away. Okay, so that's going to be our schizophrenia. Let's switch it over now and take a look at depression. So this is a very common problem, and it occurs a lot of times in people that have like chronic illness. When people have they're confined to the house, let's say like ALS, or they have MS, or they have cancer, that type of thing. We do see depression associated with those types of illnesses. So we can classify this is as a mood disorder into a bunch of different subgroups. We're going to look at, if you just want to highlight, major depression, which we call unipolar. Then we'll take a look at bipolar, and then depression as a result of an exogenous or reactive episode. We'll talk about that. So let's take a look at major depression. This is known as unipolar. This is endogenous. Its diagnosis is based on biological factors and some of the personal characteristics that the patient exhibits. It can be caused by genetic, developmental, or even psychosocial stressors, right? So this is kind of that major depression that somebody will go through, and they'll have to be treated for it. Bipolar disease is a type of depression where they have alternating, periods of depression, and then they'll flip and just become kind of manic. Everything is great, everything is, just they're very active and that type of thing. So they kind of go back and forth. And then the third one is depression as an exogenous or reactive episode. This is when somebody goes into depression as a result of a life event. I mean, let's say, God forbid, the loss of a child, even a divorce, things like that, some type of trauma. Somebody can become depressed. Or, like I mentioned earlier, secondary to some type of systemic disorder, MS, lupus, cancer, right? These are things that can definitely make somebody feel depressed. So as far as the pathophysiology, this results from a decreased activity of some excitatory neurotransmitters that you've probably heard before, norepinephrine and serotonin. Right? These are decreased. But the exact mechanism is unknown as far as why. It's suggested to be some type of genetic component. So let's take a look at some of the clinical manifestations. So it's indicated by prolonged period of unfounded sadness and affected by, and also by a lack of energy, right? So you're going to find that they don't have any energy, loss of self-esteem, right? They lose their motivation, right? They may have irritability, they may be agitated, they could have insomnia, right, where they don't sleep, or they can have the opposite, excessive sleep, right? They just spend all day in bed, loss of appetite, loss of libido. So the treatment is predominantly going to be by counseling, right? You're going to go to a psychologist, psychotherapist, that type of thing. And then there's medication. So there's antidepressant drugs that increase norepinephrine. There's other ones that increase serotonin. You may hear these as SSRIs, right? Basically, they keep serotonin in the synapse longer. There's ones that prevent serotonin and norepinephrine from being reuptaken into the neurons so that they stay in the synapse longer. There's tricyclic antidepressants. There's monoamine oxidase inhibitors. You can see there's just a bunch of different types of drugs. Electroconvulsive therapy could be used for severe types of depression. Okay, the last thing we want to just kind of mention are some mental disorders. I'm sorry, mental disorders are panic disorders. You'll see a lot of people have a panic attack. This is a sudden, brief episode of discomfort or anxiety. Right? It's usually short-lived. From whatever the stress that caused it, and the individual will be ultimately okay. A panic disorder develops when the panic attacks are frequent and prolonged. All right, so now it's getting a little bit more severe. Genetic factors are implicated. There's an increased discharge of neurons in the temporal lobe. So this is kind of the etiology. And there may be neurotransmitter abnormalities that include imbalances of norepinephrine, serotonin, and GABA, right? GABA, gamma aminobutyric acid. So some of the clinical manifestations, a lot of times patients will have this intense feeling of fear without provocation. It's like a wave of fear that overcomes them. It can last for minutes, hopefully just for a short period of time, but it can be a long time. The patient will have palpitations. We call that tachycardia, right? Just a rapid heartbeat. They can feel their chest pounding. They may hyperventilate, sweat. This is also too common sensations of choking or smothering. They can't breathe, that type of thing, and even nausea. So again, people that do have panic disorders will get psychotherapy, and there's different types of drugs that are anti-anxiety agents, and they may even be put on an antidepressant for some time until they can get over the whatever is causing their panic attacks. Okay, so that concludes our mental disorders.